So Stan, you say there are several cliches when it comes to healthcare, that things that we think we believe, but they may not be. So, first of all does the United States have the best healthcare system in the world?
Well, I do talk about the fact that there are things that we say that almost limit debate and limit an intellectual conversation. And one of those is, well, we have the best healthcare system in the world. Of course, once you say that, you've cut off debate, because why would you change it as if it's the best? So the question is, on what basis would we say we're the best? We do some marvelous things. We have hundreds of thousands of sophisticated doctors, thousands of really wonderful hospitals. But on what basis would we say we're the best? Because according to world statistics, we're far from the only thing we lead in is cost. But so in life expectancy and other kinds of measures, we trail the world in most of those.
You hear a lot on the campaign trail that healthcare should only be between you and my doctor, and we don't want a government bureaucrat having anything to do with it. What do you think about that statement?
Well, first off, if you're satisfied with where we are today, maybe that's a good statement. But if you think we can improve, and we can certainly improve on the high cost, you'd have to say, well, that attitude sort of got us where we are. Each of us, I, you, and everybody else, wants a loving, trusting relationship with our physician. But there's got to be some opportunity to follow evidence-based medicine. I firmly believe that one of the reasons that our costs are so high is the variability in the way medicine's practiced. And you look at every study, it varies by as much as 30% between here and Tulsa in certain surgical procedures. And so we have this variation in how people are treated that's unexplained. In my opinion, we'd be better off as a nation if we made a real concerted effort to follow the evidence, to follow what medical schools and professional societies have determined is the best way to treat people, and begin to take variation, this huge amount of variation in how people are treated, take it out of the system and only pay for what works. The president said we should only pay for what works. And in that case, he was exactly correct. But to get there, we've got to get to evidence-based medicine.
What about the variation between what one physician will make as, say, a primary care doctor and what a physician will make as a specialist or a specialist surgeon?
Well, there may be as much as 10 times between, with relatively the same amount of training, what a primary care doctor, a pediatrician, a family doctor may make, and what a highly trained specialist would make. 100,000 versus 1 million. And with as I said, basically the same amount of years in school.
Yeah, and a lot of years in school, not only the medical school, right, but internships that can go, what, 5, 6, 7, 8 years?
And my personal belief is that if you believe, as I do, that people that work the hardest, that have struggled enough to achieve something ought to be the most rewarded in our society, then clearly physicians ought to be tops among that, and I really believe that. But we do have to realize is that there is this variation, this huge variation in what physicians make. That variation somewhat stimulates the problem, the cost conundrum that we have. And that variation is historically based. It's because when we started health insurance in this country back in the 1930s, the physicians that really got control of those early payment mechanisms were physicians that did something. They operated on somebody, they put a catheter in, and so you could physically count and calculate what that was worth. And physicians that only spent time with you, family doctors, pediatricians, that was much less valuable because it's much harder to put a number around time.
Now, in your book, you say that Obamacare, the Patient Protection and Affordable Care Act, is important legislation, but it certainly is flawed. What are some of the big things that you think that you worry about?
Well, it didn't touch the whole issue of tort reform. It just sort of passed it by. And I think that's, for me, that was a huge flaw. It's based on some faulty economics. I don't think they were realistic about the economics. For instance, the plan anticipates that some future Congress is going to tax what are called Cadillac plans. And the theory is that there are executives and companies that have better plans than their employees. Well, but Cadillac plans are also, in many cases, union plans. So how are we to believe that some future Congress is really going to tax these plans in the future? The so-called doctor fix was not calculated. You know, we have this process where every 6 months or so, the Congress extends physician payments in Medicare because there was a law several years ago that would have taken those down, so we have to fix it every year. The total cost of the, quote, physician fix is not in the bill. So there were about 4 or 5 things that were not calculated in the bill, which really understated the total cost of the legislation. And you know, the other issue is, are we really going to see coverage of the uninsured? We have this whole controversy now from the Supreme Court is whether the states really have to step up and take on the additional Medicaid coverage. That seems to be a question. A lot of states are saying no, they won't do that. And that was the basis in most cases, how we were going to get to covering the uninsured.
I just saw a study from the Kaiser Foundation that said that Oklahoma, in fact, would be a large benefactor if they got the federal money to cover Medicaid, that we'd probably be able to cover more than half the people that are uncovered right now.
Right. Right. Well, you know,
with federal funds,
yes,
not
yes.
state funds,
well,
federal funds. Yeah.
Certainly federal funds in the beginning.
Right.
The first couple of years, the federal
It's a
funds,
sliding scale.
It is a sliding scale, and you get weaned off that federal subsidy. So ultimately it would cost the state, but it is a good way, if we were serious about covering the uninsured, which is about 19% of our population, if we were really serious, it's a good way to extend coverage to those folks.
Well, certainly an interesting book, Political Malpractice, and a fairly easy read, one that is written for the lay person, and one that I think probably we'd all be well served if we do read it. And I appreciate your insights today. Stan Hupfeld, the former CEO of Integris Hospital and author of Political Malpractice.